Neil's going to talk to us to give you an introduction to Alports, to kidneys generally. As a nephrologist, it is his expert area, and also to talk about the registry that we're going to encourage people to join. The purpose for the registry, and I just want to kind of set the context because Sharon and I were talking about this, is because there are a few of us in the UK. What we're trying to do is to try and get some information about people so that we can support some of the clinicians who are very keen to do some research, and sometimes what they need is sort of some of the family histories and things. And Sharon has been doing this with one of the clinicians in the States, and she will be talking more about it later. But if we're going to help these clinicians help us understand more about Alports, we really need to register as families and get our information on these databases. And I'm going to leave Neil to talk a bit about it to you. Neil.
Susie, thank you very much indeed. It's really exciting to be here today. I think I met my first patient with Alport syndrome in 1982. Later in the 80s, I started some research, which was actually at that time into autoimmune kidney disease, anti-GBM disease. And rather unexpectedly to me, what popped out first was the Alport molecule, which had just been described a few months previously. It's very similar to the molecule that I was working on, and ever since then, I've just been so interested in this disease, and actually it's more common and much more important than the disease I was originally working on. So in the last 15 years, I've been doing much more on Alport syndrome than on anti-GBM disease, which was my first disease. Next time I talk, we'll have this group here today, but this was the meeting we had when we began to get this group together last year in 2011. So I've got a remit to just say a few very quick things about Alport syndrome, which most people won't need to know. Cecil Alport, who first mentioned the disease, was in fact South African. He qualified from Edinburgh, of course, and then went back to South Africa, where he wasn't very successful in running a gold mine. He came back to St. Mary's in 1922, and in 1927, that slide is wrong, he described Alport syndrome, and actually he described just about everything that we know about Alport syndrome now as it appears. So just to go on, what I'm going to say in about 2 minutes on each of these topics max: what is Alport syndrome? How rare is it? How many of the patients are here today? A little bit more about why have a group and the registry. So this is what Cecil Alport described: kidney disease, which comes on particularly in young men, but women can get it too. So they get kidney failure in their teens, 20s, and some a bit later than that. Deafness, which you're not born with, and that's quite important, but which gets worse. In some people, it happens at the same time as the kidney disease, but the match isn't very close. And then there's some eye changes that we're going to hear about later on, because they're a little bit more complex to describe. One thing to say is that kidney disease with deafness is not always Alport syndrome, and there's clearly quite a lot of kidney doctors out there who need to know that, who don't know that. Most of these other causes, you're born with the deafness, but not all of them. So deafness and kidney failure, sometimes it's used as a shorthand. The problem in Alport syndrome is in the filtering units within the glomerulus. So on the left here, there's a whole kidney, two of them, one on each side at the back. Each one of those kidneys, in the middle panel, has 1 million glomeruli with tubes coming out of them. And on the right, you can see the glomerulus, the little round things, the filtering units in the kidney. 1 million of those, each joined to a long tube in each kidney. Just to give you an impression of size, you can fit 10 of those glomeruli onto the head of a pin. Now, if you take a cut into one of these and look at it, you can see some little blood vessels going through it. And here we can see 3, and there's that funny shaped thing in the middle of the middle one is a red cell. And you'll know that getting blood into your urine is a part of Alport syndrome. It has to go from where it is there across that line into the outer space there, the urinary space. So that's where all the filtering happens, across this junction here. Across this junction here. This is the red cell. This is the filtrate that becomes urine. And it's that bit that does the magic, which is what the kidney does, purifying everything. And that's what it should look like on the left. On the right, you can see the glomerular basement membrane, that thin line, has gone all disordered in Alport syndrome because one of the proteins in there is abnormal. And Francis is later going to tell you a bit about the genetics of that. So that's the basic problem. How rare is this condition? Well, the one thing that we can count really accurately is how many patients are on dialysis and transplanted. And this slide shows the increasing number of patients with Alport syndrome on dialysis and transplantation. Now, if you look at the red line along the bottom, that shows it's about 1%, and actually that hasn't changed very much. So it's just under 450 in 2010. It's probably above that now, and it's probably still rising. And actually that really tells an important story. In 1998, only 110 patients were on dialysis or transplanted, and now, at the end of that slide, there were 440, 4 times as many patients. That is a modern medical miracle, and it's mostly due to transplantation. Dialysis is a good treatment, and it's much better than it used to be, but it's mostly due to transplantation that people who weren't alive in 1998 are now surviving a long time. And what that translates into is that every year, about 15 people are starting dialysis in the UK because of Alport syndrome. That probably means that 15 patients every year are being born who are going to get Alport syndrome, are going to get renal failure from Alport syndrome, unless we can learn to do something about it. But of course, not all patients with Alport syndrome are on dialysis or transplanted. That's the 450 at the top. I don't know how many are not. I'll bet some of them are here today. But it's probably quite a lot. And if you think about carriers, people who are carrying the Alport gene, but most of whom are not going to get kidney failure, well, my guess is that maybe as many as 1,000. Now, every time, in the common type of Alports, every time you have a baby with Alport syndrome, there's probably a carrier born in the same family, on average, about 1 to 1. In fact, it might be a little more than that. But we do know that that 450 on dialysis and transplanted is rising, so we're not actually counting all of the patients with Alport. So I think it's going to be more than double that, probably. And I'm guessing maybe there are 2,000 people carrying Alport who and therefore at risk of kidney disease at some point in the UK. Now, that may seem quite a lot, but there are 73 adult renal units in the UK. And if you look at the patients on dialysis and transplantation, that's only 6 each. And there are 5 or 6 kidney doctors in every renal unit. So even though it's not such a rare disease with that many people affected, each kidney doctor on average will be looking after 1 patient with kidney failure from Alport syndrome. So I'll bet there are people here who found even kidney doctors who don't know that much about it, right? So why have a group? That becomes then a very easy question to answer, doesn't it? The problem with rare diseases is that doctors don't know about them. You don't know anybody else with the condition to talk to about it. It's really hard to find reliable information about the condition. You can find out about common kidney conditions, but when you get to rare diseases, is this information reliable? And I'd just like to make the point that this is true for staff as well as for patients. It's really hard for staff to find up-to-date, reliable information about rare diseases as well. This is why we need a group. It's worse, though. Things keep changing. So what was good information last year is not going to be up to date this year. And we also know and I'm sure many of you have stories that will prove it, that the quality of care out there, you know, the standard of care that people are getting, it's quite patchy. We're pretty lucky in the UK, actually, but it's patchy for diseases like this. So this was the thinking behind setting up rare disease groups in the UK, of which the Alport group is one of the leaders. And without going through everyone who's on the group, the steering committee of this group has 3 patients, 2 of them here today, 2 adult nephrologists, I'm one of those, 2 pediatric nephrologists, you just heard from Judy. It has geneticists, and Francis is going to be speaking later, and it has a real expert in doing clinical trials. These are studies to see what can make things better, what treatments are going to work. That's Colin Bagent. He is a professor in Oxford, and he's also a patient. There is a website that this group is beginning to use, which will have some improved information for patients, either on it or pointed to. And I think possibly even more important, it'll have the information for doctors who want to see the latest information, what tests should I be doing, what treatments should people be on. So it'll be hooked from there. And behind the scenes, it will also have some other very important things too. It'll have links to the registry, which Susie mentioned, which will enable us to pull information together from all of those patients around the UK, so that instead of just being able to look at the 6 patients in your kidney unit, you'll suddenly begin to see what Alport syndrome is like across the whole of Britain. And with people like Oliver and Sharon, we'll actually be able to look and see what's happening in Alports in other places in the world as well. And the method we're going to use to get the information together isn't all going to have to be typed in either. Many people here might know about this system, Renal Patient View. If you don't, there are some leaflets here. Please pick one up later. It's available now quite widely in the UK, and I'll show you. And it was set up so that kidney patients could look up their test results online. So the patients I had in clinic on Thursday were able to see these results on Friday morning, and I haven't looked at them yet. If I just flick through 1 or 2 pages here, here are my blood test results on this system. My creatinine's still okay, actually. And if you click on the top of a column, you'll see information about what these things are. So it's meant to help to understand the disease as well. And as you click along the tabs at the top, there's information about you, what your other diagnoses are, clinic letters, medicines, and so on. Should be in there for many people. It's not available everywhere yet, and actually pediatric units are still a bit of a weakness. But by the end of this year, we think that 63 of 73 adult units should be joined up to it. And we already have over 20,000 patients in the UK registered on this system. With the aid of that, the registry will have a really powerful tool for not just collecting who the patients are with Alport syndrome, how do we get in touch with you, who might be suitable for any new treatment or trial that's coming along. We'll be able to tell that perhaps by looking at the creatinine and who's on dialysis and so on. So I think the challenge for the future is to improve what we're doing with what we know already. And we can do a lot about that with information for patients, patients getting together, and really importantly, education for the renal units, the renal teams around the country as well. We want to prevent people joining that line of people developing end-stage renal disease and find the next treatments that are going to improve the outcome for everyone with Alport syndrome. That's what I want to say for now. Thank you very much.